years now, and I tell persons I'm not in the politics of medicine.
Right.
Right. And understand me clearly in the sense that I'm doing this long enough that I don't argue with anyone.
Yeah.
Because you know some people just tell you, well, medical doctors say to do this,
Yeah.
herbalists say do this one say do that, and all that, right? I'm not in that. Right? My training, basically, I hold a bachelor's in holistic health science, a master's in health science, and I completed 3 years ago a PhD in natural and integrated medicine. And that's a US university, Quantum University in the United States. And my area of specialization, I deal with a lot of diabetics. And that's very close to my heart simply because as a young man growing up, my great-grandmother was diabetic. And the thing is, she was a really bad diabetic. But you know, you're young, I don't really know anything about diabetes. Because she died when I was 16 years. But what I could remember is that she had what they call, people a long time used to call it a sore foot, right? Which we know in medicine now is a diabetic ulcer. And the thing is, she used to take insulin as well. And I remember I experienced with her going, because it was late, like about 6 o'clock, and she normally would eat very early. So my mom and them sent me to wake her up. And the thing is, when I realized, and she went into what is called a diabetic coma, where the blood sugar went too low. And so that's just basically to say that she died, as I said, at the age, when I was 16 years, she was 82. And for the time that I knew myself, to when she died, she was always sick. So that was one of the things that motivated me to start doing medicine. But the thing is, I didn't want to really go into Western medicine simply because, not that anything is wrong with it, but I wanted something more in the sense that I believe that people must be responsible and held accountable for their actions. And what a lot of us don't understand, you are what you eat. And anytime you do not want to take that into consideration, you will always be unwell. So Trinidad and Tobago currently, if you look at the statistics, we are one of the sickest nations in the world. We have one of the highest levels of diabetes. We have the highest level of adolescent diabetics. We also have the highest levels of adolescent obesity in the world per capita. So it means we didn't get here eating salad and walking around the savannah. We didn't get here. So it means that we need to look at what we're doing. Now, the thing with integrative medicine, the difference is what we primarily do is we deal with the root cause of the problem. Now, symptomologies are numerous. So diabetes is a symptomology of a greater problem. Hypertension is the same. So whether if you have elevated blood pressure, you know, your systolic, which is your top number, they tell you it's supposed to be like about 120. They say your diastolic is supposed to be like about 80, somewhere around there. Now the thing is, usually what you find with a lot of persons, and your pulse is supposed to be somewhere like about maybe 80, if you have a pulse. The thing is, people, or you find athletes usually have lower pulses. So if you test somebody like Usain Bolt, a professional swimmer, that type of thing, their pulse might be like about 50, 55, which is good, because it means their heart is more efficient, because for 55 beats per minute, as opposed to having 80, 85 beats per minute. But of course, if you reach a point where your beats become too low, then it becomes problematic. Right? And it could be a signal that you have some sort of cardiovascular problem. But the point I'm making, when you look at symptomology, I'll give you an example. You could have 10 persons who are diagnosed with hypertension. But the 10 persons have 10 different reasons why they're hypertensive. So I'll give you an example again. So let's say someone is constipated. So you don't have proper bowel movement, you're not going off properly. That could result in you becoming hypertensive. But that's one reason or one cause of the same symptomology, which is high blood pressure. I can give you a next example. Let's say you have someone who is dehydrated, because you have people who have the foolish notion that water doesn't taste good. You know, people just tell you that nonsense. I don't like to drink water because it don't have a taste. Water is not supposed to have a taste. Water is not juice, nor is it soft drink. It is water. So the thing is, if you're dehydrated, you could reach the point where you're so dehydrated, you could end up having elevated blood pressure levels. So that is, again, a different cause with the same symptomology. I'll give you a next example. You could have a female who is going through a stage in her life where she's now premenopause or menopause or postmenopause. So because of that, she's now experiencing hormonal imbalance as a result of that. And because of that, she's now hypertensive. So that is, hormonal imbalance has now resulted in high blood pressure. So you see, 3 different causes all give you the same consequence. So that's one of the things I tell persons, and at Batson Associates, that's one of the things that we do in helping persons to understand. Listen to me, you need to deal with the root cause of the problem and not necessarily have a plaster for a song. Now the thing is, our body speaks to us a lot of the times, but most of the times we do not listen. We ignore it. You think, you know, you're young. Men have a tendency, they don't like to check anything. Because for men, every pain is gas, something, you know. This time you get a heart attack or something, maybe wrong with your prostate or something like that, and you think it necessary to not go and check. Simply because, you know, men sometimes, you know, like for example, prostate problems. That's our next problem we have. Trinidad and Tobago has a high situation where we have a lot of men with BPH, which is benign prostatic hyperplasia, so your prostate swelling. So you find when you're going to urinate, you're not urinating properly, you're getting burning. And then you might go to the doctor, and the doctor says, well, okay, we're going to do a test. So we do a PSA, which is a prostatic specific antigen. So there's a blood test that is specifically designed to read prostatic antigens in the blood. So the normal range is supposed to be anywhere between 0 to 4. You go to the doctor, they check it, and the doctor might say, well, okay, we're seeing you have an 8. All right, what does that mean? So it possibly means that you are now experiencing prostatic hyperplasia. The point I'm making is that, you know, the old people have a saying, an ounce of prevention is always better than a pound of cure. And that's why I say I'm not in the politics, because what we as citizens and individuals need to understand is that your health is your personal responsibility. The hospital and the doctors are basically there for one reason and one reason alone. That's emergency primarily. The hospital is for emergency. The hospital is not Hyatt, it is not Hilton. So when Christmas comes, you don't go and eat black cake, and you know you're diabetic, you drink sorrel, you know you have sugar. You go and eat ham, you drink alcohol, and then your blood pressure go high, and then you rush in the hospital and say they don't have any bed. They're not supposed to have bed for you. It is not a hotel. No, and that's and I tell people, that's a serious thing. So we have to understand, as a nation, because the human resource of any nation is its most important resource. And the way we're going in this country, in about the next 20 to 30 years, we wouldn't really have much people. I'm telling you. Because the adolescent diabetic population in this country is huge. My youngest diabetic patient came to me at the age of 5, and he was on insulin. He's with me 2 years now, he's now 7, he's no longer on insulin. Because I had a problem with a 5-year-old child taking insulin. And what I did, I worked with the parents. They get a little buff. They didn't like it, but yeah, you come to me, I didn't come to you. And the child wanted help. And the reason why the child became a diabetic, it had nothing to do with genetics. It had nothing to do with the child's birth. It was because they used to give the child soft drink every day because he wanted a soft drink to drink. I came from old school. I couldn't tell my great-grandmother what I wanted to eat. You eat it or you lay down close it. No, serious. Yeah, I remember a time they cooked something, I didn't want it, and I sit down there, I do. I figure out, nah, boy, this thing ain't working, boy. I turn her hungry, I gas, I belching, nothing. And my grandmother not budging. I give you that to eat, you have to eat that. And I think that's one of the ways that parents need to go with children now. Because let me tell you something too, because I could talk about health whole day. When you look at the young women that we have now, polycystic ovaries, fibroids, ovarian cysts, endometriosis. So you have a 16-year-old female going to school. She can't do well in school because when her menstrual cycle comes, she can't go to school enough. She's sick. You have to be taking painkiller. What sense that make? And then the thing is, again, not criticizing any system or doctors, but the thing is, you go to the doctor and the doctor's supposed to ask the first question, how much water you drink? Because before hydration, because you could go days without water. No, not without water, sorry, without food. Food, yeah, that's it. Without food, but water, you cannot go.
Everybody there. Yeah.
That's it. You can go days without food, but water. And then before water is what? Oxygen. Because if it is, you cannot breathe. You will die. So the human requirement for the human body is oxygen first, hydration, which is water. Then after you go into things like your carbohydrates, your proteins, your fats, your lipids, that type of thing. And then you go to your macronutrients, your micronutrients. And a lot of people don't understand that. So we have people who you're starving and you don't know you're starving enough. Because you're diabetic and you're doing the right thing. So you go into the clinic, you might be on glucophage, you might be on diamicron, Dionil, whatever the case may be. Or you might be a type 1 diabetic where you're using insulin. And that's good. You're following your routine. You're testing your blood sugar ever so often. But the point I'm making is that you are your own doctor first, the doctor that living in your house. So people, you cannot take medication and don't test. That's the next thing, don't do that. Your vitals is very important. Always know your numbers, know your pressure, know your pulse, know your blood sugar reading, especially if you have been diagnosed as a diabetic. Because, I'm going to make a controversial statement, I don't use the word cure because cure could put you in court. So we're not going to talk. We're talking about reverse. So people ask the question, can I reverse diabetes? Waiting.
Yes.
You think so?
I believe so.
Why? Why you believe that?
Your lifestyle.
Your lifestyle. I tell people diabetes is like weight gain.
Yeah.
If you eat badly and after you reach a certain age, if you eat after 7, 8 o'clock, the fat ain't really going nowhere because you're not supposed to really eat that hour the night. So you realize that you start to put on more weight. But if you want to lose weight, what do you normally do? You start eating vegetables, you exercise. So the same applies with diabetes because people say, I don't eat certain things because I am a diabetic. But people who are not diabetic supposed to be on that same program. Because sugar is one of the fundamental problems that we have. Because sucrose, which is table sugar, is not natural. You have glucose, you have fructose, which you get from fruit. But we know with diabetes is when you have elevated blood glucose levels. Because glucose is not supposed to be in your bloodstream for any extended period of time. Which is why people who are diabetic end up with complications associated with diabetes, which is poor circulation. Because what happens to a diabetic, the first thing that goes is your circulation. After your circulation, your nerves begin to go. So they tell you have diabetic neuropathy and all those type of things. But when you look at it in its totality, the point is, regardless of what you have, there is always an underlying reason as to why you are sick. Disease, whether it's hypertension, diabetes, cardiovascular problem, arthritis, polycystic ovaries, prostate, whatever the problem is, even cancer, it has to have an underlying issue. And this is the last point I'll make before I finish. 99.9% of the times, your underlying issue is your gastrointestinal system. Because your colon, your body is divided in this way, right? You have cells give you tissues, tissues give you organs, organs give you organ systems, and organ systems give you the body. So basic biology, right? So we know the human body is comprised of what? 11 organ systems. So you have your musculoskeletal, you have your endocrine, you have your sexual reproductive, you have your cardiovascular, lymph, right? Different organ systems. The thing is, your gastrointestinal system comprises many different organs. So you have your mouth, teeth, tongue, right? Then you have your go down esophagus, small intestine, stomach, small intestine, right? Good. So the thing with that entire alimentary canal there, right, once you have imbalance taking place there, because 70% of your immune system lies where? In your gut. So if your immune system, which is the defense system of your body, 70% of that is not functioning well, you don't have to be a mathematician, we know it 30% alone. And we're not too sure what is the condition of the 30%. It means that you now open to problems. And it simply means the body now creates an environment that is conducive for disease. Mosquito don't live in the ocean. If you go Maracas and you're bathing, mosquito just bite you. I mean, you might get mosquito, but it didn't come from the sea. Because mosquitoes cannot breathe in that type of water. They need stagnant water to exist. So with the body, in order for disease and sickness to lay hold of the body, especially cancer, because I tell people, I don't really like to talk about cancer too much because it's very controversial. And people just tell you, well, we don't have no this and that. No, it's our environment. Now, one key point is that stress, and I was having this conversation earlier with somebody, the stress could actually create an environment that will kill you very quickly. Why? Because there's a hormone known as cortisol, and cortisol is the stress hormone in the body. Once your cortisol levels are elevated, your body is open to a number of things. So it means the body is now conducive to having problems. So diabetes, hypertension. That's why they say you mustn't take on stress. That's a serious thing. And the thing is, all of us have stress to deal with, so you have to be able to know how to deal with this stress. And that fundamentally is where health and being healthy. So when I tell persons, you have to understand what it means to be healthy, because you have different aspects of health. Because when you look at the human body, and this is the last point I'll make and I'll finish, you basically, your body is 5 different aspects, right? So you have your spiritual body. That's the most important. Because people tell you, okay, if it is you're sick, and I'm going to be a little controversial here again, some people in the medical community believe that prayers don't work. But that's not true. Because they show you, they have research, they show this. Let's say you are patient A, the patient A is in the hospital, they're sick, they have certain problems, right? You have patient B. Now, you have 100 people praying for patient A and 100 people praying for patient B. But the persons who praying for patient A know all the intricate details of what patient A is going through. So they know patient A name, they know the disease, they know everything, right? Now with patient B, you have the same amount of persons praying for that individual, but they don't know details. So they don't have a name, they don't have anything. Who you think will get better first? I'm going in a different realm here. Patient A. And watch man, this is scientifically proven. You know why? Because the said persons basically asking for the same thing for that particular individual. Don't underestimate prayers. Now I tell people you cannot mix foolishness with faithfulness. Because some people think, well, okay, I'm serving the Lord, whatever the case, I can eat what I want. Yeah. That's Miss Ramdan works here. This is one of our senior consultants, Karishma Ramdan. She said, don't mix faith with foolishness. Right. And that's a serious thing. Yeah. But the thing is, you have a spiritual body, and that's a serious thing. After that, you have what is known as a supramental, or what is known as your subconscious mind. That's a serious thing. Then you have your mental, which is your conscious mind. You have your vital, which is your energy body. And you have your physical body, which is your physical body. Yeah. Now, a lot of people do not know that your physical body is the last body. And it is usually the body problems in bodies higher up that is cause physical problems. I'll give you an example. I was just telling someone this day. If you're living in a house where you're not happy, you might be in a relationship. Because this happens, people married. You're married and all ain't going well, but you're in the marriage for whatever reason. You're going to the doctor, you have problems with depression, anxiety, you can't sleep. What you'll get? Tablet. So you get some sleeping tablet, and I give some Zoloft, they give some amitriptyline, they give you something. Right? Now, what we dealing with there? We dealing with the physical body, but your problem is what? You have an emotional and a psychological problem. So you want to take all the tablets in the world. You could stop tablet from now till your problem will not go. No, and that's why you have to look at it. It's a simple thing, you know. People just make health sound like it's so technical. No. It's a simple thing. Your mind and your heart, you don't like your neighbor, you don't talk to your cousin, you don't like your brother, you don't like your sister. That rottenness to the bone, the Bible tells you that in the book of Proverbs. Yeah. So you actually giving yourself sickness, and a lot of people don't understand that. So I'm just trying to help you to understand that there are different aspects. Because people say, oh God, Dr. Watson, they tell me not to eat this, they tell me not to eat that. Oh God, what to do with it? Because you reach the point where it's almost analysis paralysis. But it's simple. You just have to understand what are the basics. And once you deal with the basics, you will get better. You will get better. And look at the symptoms. You find you're getting headaches often. No healthy person is getting headache all the time. I don't care if they tell you you have migraine, you have cluster, headache, something is wrong with you. If you're not sleeping, something wrong with you. You're a female, you have a painful menstrual cycle, you're passing too much of blood, your blood count looks something wrong with you. You're a male, you're not urinating properly, you're getting burning, something is wrong with you. You're feeling dizzy. When you get up in the morning, you're like a car, it's like you're starting, you have to warm up before you get up. Something wrong with you. Something wrong with you. You don't get sick just so. And a lot of times people don't understand stroke. Let me tell you something. Most people who have gotten strokes, you have two types of strokes. You have ischemic strokes and you have hemorrhagic strokes. Hemorrhagic strokes are bleeding strokes. Ischemic strokes are non-bleeding strokes, but it simply means you have lack of blood flow to the brain, lack of oxygen, so you have some damage, right? 99.9% of the persons who have ever had strokes, that was not the first stroke. There are mini strokes which are called TIAs, which are transient ischemic attacks. If a doctor does a CT scan, in MRIs they could pick it up, but most of the time CT scans, the neurologists use it, that type of thing. They would have realized that you would have had many strokes before, but what you have now had is a major stroke. Heart attack too. The first heart attack you get is the first one that was bad enough to throw you down. You get before, but you didn't know. Because a lot of times I have known of persons that have had massive heart attacks, and when the forensic pathologist did the autopsy, they actually saw you see stripes on the heart itself, which was indications that that person actually had heart attacks before. You find that to the side of your face is getting very dark, by your temples, by your eyes, that is normally an indication you're not getting sufficient blood going to your brain. If by your feet or your insteps starting to look dark, you're getting pins and needles cramping in your calves, burning under your feet. Poor circulation. You find you're getting headaches, but your headaches is not your whole cerebral hemisphere. So your whole head not tilting you. your forehead, your eyes alone, the back of your head, your right side, your left side. No, something wrong. It means you're not getting enough blood somewhere. All of a sudden, you're getting dim vision, you have blurred vision, you're not seeing properly. Problems with your eyes. 99% of the people who I have ever dealt with who were glaucoma, you know what glaucoma is? High ocular pressure in your eye, right? 99% of them were dehydrated people. So dehydration is fundamental to health, but especially the health of your eyes. So if you're dehydrated, you cannot have healthy eyes. So you go in, they're giving you an eye drop, they want to give you an injection in your eye, they want to give you a laser, and nobody asks you how much water you're drinking. And to tell you stop drinking coffee. Alright? So with that being said, I know the time and I know all of you all wanted. What we're going to do for you guys, there's a voucher system that we have there. We're going to give it to the persons that we have done check for and whatever the case may be. But it's something that we're basically doing for the month of February, and we will continue. Most likely in the month of March. The young lady who invited me here, I cannot remember her name. Vicky. Yes, Miss Vicky. We have some extensive conversations. So we have locations. We have Shagona, St. James, we have Dede, and we also have Tobago. So what we'll do, you'll basically get the voucher, which allows you certain things. They will further explain to you, and you can afford or yourself of that anyway from now till the end of March of this year, God's willing. All right, and we would be open to a lot of questions, any other thing that you may be able to want or need. We have a very good eye drop that we carry. Because you see, the thing is, I tell persons, even if you never come to me or us, that is not important to me. That's quite all right. Believe me, it has been enough people in Trinidad and Tobago for me to deal with. Right? But the thing is, you must take away something. So I hope with what I have said today here that you take away something that could benefit you and your family. Because at the end of the day, I tell people, if you think health expensive, try sickness. I know people empty bank accounts, estate, they sell 1, 2, 3, 4 house and they still die. Simply because they waited until it was too late. Somebody told me, I was telling them about the soft drink they're drinking, and they said, well, Doc, that's all right. If my kidneys go bad, I can get a kidney transplant. I say, you know how much for a kidney? Yeah, well, that is it. And one of the final points I'll make to nothing that you have works better than your own. No? You see, your eye doesn't tell you when they do cataract surgery, is a lens that is put in your eye, an artificial lens. Yeah, they don't clean cataract again. No long time ago, and you got a good doctor, like people like Dr. Namsu, and they're not wrong again. And Dr. Namsu would have cleaned the little cataract on your eye and send you on your merry way. They don't do that again. Now they're doing lens replacement. So they take out your lens and they get an artificial lens and they implant it in your eye. Right? And then people have a tendency, they say, well, okay, if things go wrong with me, I'll just do a surgery. Let me tell you something. Good surgeons, who are some of them are my very good friends, will tell you that surgery, if I take a glass and I drop it on the ground, we break the glass. And we take the glass and we find all the pieces and we stick it back together. It's the same glass?
At all.
Exactly. Your body is the same thing. And a lot of people don't understand that. They have something called scar tissue and something called adhesions. And you don't want to get at it. When they do surgery, like women who do hysterectomy, where you remove your uterus and you take out your womb, then when they sew you back up, what they realize is after you get adhesions, which is like we call it like, people have bad flesh. So it actually fuses, and it could go and fuse up all by your heart and your... So the least amount of surgery you have, plenty of surgeons wouldn't agree with me because of course that is the salary. Yeah. But it's the truth. The least amount of that you do, the better off you will be. So that's our next reason for you to take even better care of yourself, because there's no such thing as a simple surgery. Anytime you make an incision in the body, you open the body up to two things. You open it up to blood clots and you open it up to infection, which is why they have to give you antibiotics. And that's a serious thing. So keep that in mind and don't run to everybody who tell you, get a second, a third, or fourth opinion. There are plenty of people who don't like me for that. I tell them, listen to me, the doctor tell you need to cut. It have a next doctor ask, get your report and go and answer a question. Because sorry is a small word that cannot fix plenty big problem. Yeah, so when they finish, and you're lucky if you get a sorry, yeah? You might say, well boy, so and so is the case. That is it. So, as they say, an ounce of prevention is better than a pound of cure. So thank you very much for your time and your attention. These lovely people here. I have a question. David? Yeah, one in David, Shogunas, St. Jim, Baxter and Associates. Okay, sir, no problem.
Do you have any cards?
Yeah, we have stuff here, so they'll organize.